So my auntie had called me and she had let me know that she was in the hospital. This happens a lot because she has a lot of medical issues that have not been resolved, despite her always going to see doctors and visiting hospitals and having laboratory work done. One of the first questions I ask when I go to the hospital with her, or if I want to know about what's going on with her, is where are her labs? When I ask for her labs, it's not like I'm sitting there trying to disrespect anybody. It's more so that I want to put my professional view and be a part of her medical team, her healing team. Because as a laboratory professional, I want to know what her labs look like and then what you guys are doing to her based off that information. So the next question is, based off her lab results, what type of care is she receiving from you? It might be seen as aggressive, but in reality, all it's asking is, my auntie came in here and it says that her sodium levels and her potassium levels are out of whack. How are you tailoring a treatment to help with those numbers? That question actually shows that she came here with the specific, y'all discovered the specific issue. Now, what are the follow-up steps now that knowing her labs look like this? And then also be respectful to these medical professionals, because the way that a lot of these hospital systems are set up is that there are like maybe 40 bodies, I'm exaggerating, to like one nurse. So therefore, the care that you want your family member to receive, they're probably not even the most critical patient that this person has. So also consider the fact that this nurse or this doctor might be trying their best to take care of your loved one, and you could be adding fuel to already burning medical system where there's not enough in medical professionals for each patient. And that's a financial thing that they technically can't control, but quality healthcare still can be done with that number looking like that. So that's not an excuse to treat people rudely or to give them inadequate healthcare. That's just a layer of understanding. Okay, this is also a factor, but treat these people like humans. Like, treat these medical professionals like humans, and these medical professionals need to treat you as the patients and family members as humans as well. The last question would more so be like a plan. So now that we know that this is her lab work and this is what it looks like, we know what methods you're using to try to treat her. Now, if these methods are not working, what is the next step? If these methods are working, what are the next steps? How should we prepare the rest of our time here when it comes to having final words or wrapping up what's going on here? Like, is this something that, we can move past, ignore, or is this severe to where she has to be hospitalized? Can we treat this at home? Can you give her some medication? Can you give her some advice that's medical based, such as, hey, don't stand up too fast, hey, get 6 hours of sleep, hey, don't eat after 9? Is that something that can be done? Or is it she's staying here because she's in a severe state that if she goes home, we don't have the skill set to be able to take care of her? Those are also like the final wrap up question, is based off what's going on here, what next? And that's important so that you just understand fully about what's going on. And the doctors or medical professionals might give you something like generic of a question or answer, but still make sure that they give you a valid answer that you can feel comfortable enough walking away with. And this is a question that you ask the doctor, because they are the top of your care team, not the nurse, because the nurse is following orders from the doctor. That type of last question is something that, you can ask the doctor. Now, where are the labs? You can ask the nurse, what are you guys doing based off the lab work? That's something you can ask the nurse. And the follow-up steps is like really a doctor question. You can tailor those all to a doctor as well, but I would prefer you to do it to a nurse, those first two questions, because with what the doctor has provided for your treatment plan, the nurse is actually implementing it. So the doctor is the brain behind your treatment, and then the nurse is like the action behind it. So it's important to ask those two action questions to the nurse, and then the final question, which is a foreshadow. That is something that you ask the person who created this entire scenario in the first place, which is your doctor that had a care plan and a care team executing that plan. So those are pretty much the three questions that I would ask going to a hospital and trying to make sure that the loved one or yourself is getting the care that you need to receive, and you're understanding the type of care that you're receiving.